In this video, I'm going to share with you how to take vital signs like a pro nurse. And if you stay until the end, I'll give you some very important tips that can help you get the most accurate reading possible. Let's get started. I'm an RN with over 20 years of experience in critical care. If you enjoy medical education videos like this, please subscribe and click the notification bell so you never miss a new release. The first step is to wash your hands. If you have gloves on, make sure they are non-sterile because you're not going to be touching the patient with them. So let's put on a new pair of gloves. And I'm going to use this mannequin for our demonstration. The acronym for vital signs is VTAR, S standing for vital signs, temperature, pulse, respiration, blood pressure, height, weight, and pain assessment. Although pain assessment is a separate topic altogether. For the purpose of this video, we're going to focus on the following. Please note that different facilities may have different protocols regarding which vital signs to assess. So check with your instructor or your preceptor for clarification on this. Let's start with temperature. There are 3 places that you'll most likely take a temperature orally, tympanically, or via a rectal route. I'm going to demonstrate the oral route on the mannequin. First, make sure the thermometer is at room temperature and it is either disposable or that you've wiped it down with a clean cloth. Ask the patient if they've had anything to eat or drink within 15 minutes, because if they have, the reading will be inaccurate. Now, depending on the type of thermometer you're using, there are 2 routes you can take. With a glass thermometer, shake it down, then place it under the patient's tongue. With a digital thermometer, just turn it on and place it under their tongue. When the thermometer is done, remove it and record the temperature. For a complete list of normal temperature ranges, check out the link in the description below. The next vital sign is pulse. To take a pulse, you need to know the rate, rhythm, quality, and strength. Rate refers to the number of pulses felt during a minute. A normal pulse rate for adults ranges from 60 to 100 beats per minute. Anything lower than 60 is considered bradycardia, and anything higher than 100 is considered tachycardia. Feel the pulse for 1 full minute. If you don't hear an audible pulse, start with the carotid pulse. Then move to the radial pulse, which is what we use most often. Place the tip of your index or middle finger on the radial bone, avoiding pressing too hard. You should feel the pulse within a few seconds. Document the pulse rate, rhythm, and quality. If you notice any abnormalities with the pulse, such as an irregular rhythm, a skipped beat, or a fluttering sensation, report this to the provider immediately. Next, we're going to move on to respiration. Respiration refers to the rate and depth of breathing. To assess a patient's respiration, observe the rise and fall of the chest or abdomen while the patient is breathing. Don't alter the patient's position or talk to them because this could alter the results. If you notice any abnormal breathing patterns or sounds, document this along with the rate and rhythm. Now we're on to blood pressure. Blood pressure measures the force of blood pushing against the walls of arteries. It's assessed using a sphygmomanometer. Make sure to use the appropriate cuff size based on the size of the patient's arm. Position the patient's arm at the level of the heart and apply the cuff. This video demonstrates the correct technique. An incorrect technique can result in an inaccurate reading. When you hear the first sound, that is the systolic pressure, and that's followed by the diastolic pressure where you no longer hear the sounds. Make sure to record both numbers. If the blood pressure is elevated, follow your facility's protocol on the action to take next. Last, but certainly not least, is pain assessment. Pain is subjective and unique to each patient. Ask the patient to rate their pain on a scale of 0 to 10. Also ask them where the pain is located. Document the pain assessment in the appropriate area of the chart. I hope you found this tutorial helpful. If you did, please leave me a thumbs up and share it with your classmates or friends. For more nursing videos, visit our channel. Check out these videos next. See you there.